సార్ అదేదో ఫేస్బుక్ లైవ్ ఉంది కదా దాంట్లో ఉన్నా చెప్పండి. ఎందుకు సార్ చెప్పండి. అదే చూస్తున్నా అది. ఓకే చేస్తా ఇప్పుడు. హాయ్, ఐఎమ్ డాక్టర్ Gopichand. I'm from Kim's Hospital. That is in Secunderabad. It's my pleasure to be in this Facebook Live, online live, for a small education program on men's health. And I'm very thankful to the audience who have taken their time out to be with me. Very busy afternoon for a lot of you. Today I'm going to talk on a very important topic, that is men's health. Next slide. Okay. So when we are talking about men's health, we will go into this. But basically, I'd like to tell about who is a urologist. What is urology? Urology is a subspecialty of the surgical science. We do around 14 years of this. First, we do masters in general surgery. Then tarvata we do around 3 years in MCH, that is the super specialty in urology. Urology ante kidney, bladder, then the reproductive organs, the testes, దీని గురించి we are a specialist. So essentially we deal with the diseases of kidney, bladder, stones, prostate, urine problem, then men's health, especially the erectile dysfunction, sexual problems, ఇవన్నీ చూస్తామండి. So basically urologist is a very long course, and then today especially I will talk about men's health, because most of the patients in men's health it is morely about the diseases that the men suffer. So we will talk about it. Next slide. Okay. So men's health has always been a very neglected kind of aspect. Most of us, we do not take care of the health and all properly. So it is very important for us to know about it. Mainga, why we don't take care is that we are very confident and we feel that we are invincible. So especially when we are in our early age group, I will talk mainly about men's health today in this program. My main motive of this program is to heighten the awareness of the preventable health problems and encourage early detection and treatment of disease amongst men and boys. Next slide. It is very important for us to think that we are not invincible as far as the health issues are concerned. You can see, according to this major study, a lack of awareness ante manamu ekko pattichukomu, weak health education and unhealthy work and personal lifestyle have caused a lot of deterioration in the well-being of men, especially world over. It is not only Indian men, world over. So all these things are very important, so that we have to give some time for our health and all those things. Next slide. Most men need to pay more attention to their health compared to women. Men are more likely some habits like smoking, drinking. We have unhealthy or risky choices as far as health is concerned, and we put off our health checkups, medical care, idantha ekko teeskomu. There is, next slide. There are also health conditions that only affect men, such as prostate cancer. And then there is a very important aspect of low testosterone, which will have to, we don't take care of that, but low testosterone also very important. Many of the major health risks like colonic cancer, heart disease, all these things, including the prostate cancer and low testosterone things, all these can be prevented with early diagnosis. అంటే అర్లీగా డయాగ్నోస్ చేస్తే all these problems ఇవన్నీ మనము we can prevent all these things. Next slide. Very important is that belly fat. It is very important, and why weight loss matters. Next slide. Belly fat, especially, what all it causes, it it is at a different level, that people who are fat in the tummy region, they have a higher propensity of cardiovascular disease, insulin resistance, type 2 diabetes, colorectal cancers, sleep apnea. They have more this thing of premature ejaculation, and another problem is blood pressure. So once we take care of this belly fat thing, so many advantages we are having. Next slide. Another aspect is cancer in men. Not that, all these, next slide. So it is like this, there are many cancer which are more common in men, and there are many symptoms, and important for us to understand these symptoms, like severe unexplained diarrhea. This is one symptoms. It is not that, unexplained without many treatment also it is continuing. That is important. Severe unexplained constipation continuously in spite of treatment. No, we have to. Then unexplained severe dyspepsia, gastritis, all those things. Very important is blood in urine. Blood in urine, there is a very high chance, around 20% chance, especially in aged men, that there is some problem inside the bladder or prostate or kidney. So should not be taken so lightly. Then we have this unusual coughing, unexplained weight loss, uh, excessive fatigue, urinary leakage, and delay in urination. These are not the symptoms of malignancy, cancer, but definitely there will be a prostate enlargement, all these things which are possible. Lumps in testicles, even male breast also, there are sometimes lumps, and these are very important that, we take care of these things. Next slide. Should I get tested for prostate cancer? No, this September month, next slide, is up. Next slide. Prostate Cancer Awareness Month. Before that, there is one slide, I think. Yeah, you can press this. This is a small talk in it. No? Okay. Then another important aspect that I wanted to dwell today, discuss, is low testosterone level hypogonadism. Next slide. And testosterone is mainly produced in testes with regulation from pituitary gland, brain lobe regulation. And then it really helps in the muscle mass, keeping low levels would cause increased body fat, fatigue. There will be problems of low testosterone in having sexual issues and all those things. So we need to check this, especially we are around 50s. Next slide. There are two sides of testosterone. High also is not good, low is also not good. High causes abnormal prostate growth, infertility, irritability, excessive hair growth. Again, low also infertility, fatigue, muscle, the pot belly, the erectile dysfunction, depression, all those things. Next slide. One small aspect I wanted to touch in men's health is men and depression. Next slide. Definitely, men are depression is more in women because of stressful life events and all those things. But men also, next slide, please. Um, Men also have experienced their symptoms. The symptoms are different. Don't expect that they will only be sad. Sometimes they become aggressive instead of sad, and there are even doctors are not able to recognize this. There is anger, aggression, all these things are also the symptoms of depression. Next slide. So the common symptoms, signs and symptoms of depression are feeling worthless, useless, empty, sad, lot of loss of interest in activities you once enjoyed, feeling angry and irritated, no particular reason, difficulty in focusing anything, feeling distracted, eating problems, no, so many things also. This is all important for us to take care of this as well. Next slide. I will now delve into a very important aspect, and that is reproductive health. Um, so, which next slide, which should include, it is every right of every human being, and we must have knowledge about contraception, about HIV/AIDS, sexually transmitted diseases, disorders of reproductive system, fertility, infertility, all those things. Next slide. There is a very common link between hypertension, diabetes, hypogonadism, dyslipidemia, tobacco, even important. All these are interlinked and erectile dysfunction. Next slide. In fact, ఏమవుతుందంటే erectile dysfunction itself is sometimes the precursor of all these. It tells us about hypertension, atherosclerosis, all those things. Very important thing that we should know is about metabolic syndrome, high blood pressure, high blood sugar, low HDL cholesterol levels, high triglyceride levels, and excessive fat around the waist. Next slide. So, metabolic syndrome causes things like neurological disease and stroke. So it is important for us to really take care of this. Metabolic syndrome is one preventable cause. You can see all these things that we had talked about: high blood pressure, high blood sugars, low HDL, high triglyceridemia. All these things are preventable cause, and you can very easily prevent. You have to take care of your health to prevent these things. Next slide. A very important aspect of men's health and urologist in men's health is about reproductive health. Next slide. And in that is that what is a sexually healthy person. He has his own rights. He knows what are these diseases. He has access to the treatment, and he knows how to prevent all these problems. Next slide. So what is the definition of sexual health? Is that a sexually healthy person has access to healthcare and information about it. He is able to form and maintain healthy relationship, act responsibly to the personal values, and he knows appropriate boundaries of it, comfortable with the body and sexuality, is able to recognize the risk and ways to reduce them. He can know the body, how it functions overall, and understands the risk, responsibilities, and consequences of the behavior. Next slide. So erectile dysfunction essentially is inability to develop or maintain full erection. Psychosocial causes are very common, like because of stress, performance anxiety, depression. There are also causes of organic causes like atherosclerosis, blood vessel problem, hypertension, diabetes, all those things. But mainly the common cause is this, psychosexual problems, stress related and all. There are, next slide. There are excellent treatment available for this, but the other important causes like smoking, obesity, depression, consuming drugs, liquor, medication induced, and metabolic syndrome, one of the very important cause. Next slide. So if you look at this graph, when does it start? Most of the sexual issues, the erectile dysfunction, they start at around 50 years of age. So this is very important to know that around that age, menopause kind of thing comes, and it causes the beginning of this erectile dysfunction. Next slide. But just don't think that 50 is the cause. When you look at the prevalence, it is around 8% prevalence in the younger age group. 20 years age group, it is 8%, around 30, it is coming to around 12%. So 1 in 10 people at the younger age group also have this sexual problem, sexual issues. Next slide. There are excellent treatment available, including pills, sildenafil citrate and all. They really work well, and surgery to the level of other surgeries also available. And next slide. So before we close in this talk, I will talk about this osteoporosis, which is very important. Next. Because we think that it is not there in men, but no, osteoporosis is pretty common in men as well. Menopausal kind of things happen in men as well, and because of various problems like low testosterone levels. Next slide. All in all, men's health is absolutely important. You can look even in the Western countries, the overall survival. Men live for around 76 is their life expectancy. When you look at the women's life expectancy, even in developed countries, is around 5 years more than men. And 12% of men around 18 years, they have fair or poor health. So very statistics which would think we look at this, both the statistics. I think men should also take care of health. Next slide. Essentially, we have to look into 4 things: awareness about men's health, prevention of all the diseases. To prevent, you should have good education regarding this, and all in all, you must know that families are dependent upon you, are the main breadwinner, and the families are also dependent upon you. Next slide. Urologist is a specialist who is fully trained for all these problems, because just like a gynecologist for females, they go mostly to the gynecologist. As a branch, urology across, they are available everywhere in the state. Every district has around 5 to 6 urologists, and you must consult a urologist. There are many reasons to come. These are all the reasons to come and see a urologist. Apart from that, September being this prostate cancer screening. For prostate cancer screening, I'll just talk about 3 things. One is consult a urologist. He will do a direct digital rectal examination mostly. He might send a prostate specific antigen, and depending upon this, he might ask for ultrasound guided biopsy. The role of urologist in men's health is extremely important. It is becoming more of a role of a male health practitioner, so who looks into all these aspects. So he is a very important person today to enable the early detection and prevention of chronic diseases that can occur in men. Next slide. Next slide, please. So I'm Dr. Gopichand, and I'm available in Kim's Hospital, and I will take questions. This was just a talk, just a breather kind of thing. I will try to answer whatever questions you want to ask. Okay. That's it? No. Okay.